Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our Health Talk today is a creative and immersive therapies. My guest speakers are Dr. Drake and his wife, and they are the director of creative and immersive therapies. They are going to talk about some of the ways to reduce anger, anxiety, depression by their therapy. And it will be very interesting taping today, just listening to them what they are doing. Good morning, Dr. Drake.
Good morning, Dr. Prasad.
And can you give your introduction to our viewers?
Sure. So thank you for having us this morning. I'm Dr. Cassius Drake, and this is my wife, Jacqueline. We are the co-founders of the Drake Center for Transformative Healing. And that is a center where we use ketamine-assisted therapy to treat depression, anxiety, and other mental health issues.
So that's very good. So now tell me, now Jacqueline, can you give your introduction to our viewers and tell us what is the role?
Yeah. In our work at our center, there's part of the therapies that we do are with creative and obviously immersive. And at our center, the Ketamine Center, it's we really try to utilize all of the healing modalities, and that's where we brought in immersives, the creative side, because we really tried to pull it all in.
These are non-invasive modalities.
Yes, a lot. But there is a little bit of invasive because we do give a shot for the medication part of it. But around the medication treatment part, there is a lot of therapies on both sides of it.
Okay.
There's therapies beforehand, a lot of, there's intake, there's prep, then there is also the integration part. And the integration is really the therapies of using the modalities, but also using what the patient has experienced to really put it into their life and really make that become a part of their life.
Okay, so husband and wife makes an excellent pair. Yeah. So question for you, Dr. Drake. What, I know you have emergency medicine background.
Yes.
What made you switch from emergency medicine to this area? You know, I'm also an emergency medicine physician, but I got burnt out.
Yes.
That's how I switched my career.
Right. So I was an emergency room physician for 20 years.
Okay.
And I also suffered from that burnout, and eventually retired from emergency medicine and transitioned into this work. And part of that burnout for me was in the emergency room. You know, there's people who have critical issues that need emergency treatment, but as you know, a huge percentage of those patients actually don't have an emergency, or they have a problem that can't be resolved in the emergency room.
Right.
You know, a chronic problem, a painful problem, something that really affects their life. But there's no solution in the ER. And that's very frustrating for the patients. It's very frustrating for me as a physician. And as I learned over the years, many of those patients had an emotional issue or a stress-related issue that was flaring up physically. And so I would start discussing with them about that side of things, and began having discussions about patients about how understanding that could help them physically. That led into getting into psychedelic-assisted therapy, because the use of psychedelics allows people to heal that deep emotional stuff that may have been showing up in a physical way. So it allows me to do what I'm passionate about, which is to talk to people at depth about their emotional state and their spiritual state and how this all ties together, and to bring in all of my accumulated emergency medicine knowledge as well.
So that's very good. You know, basically my situation was the same. I was getting burnt out with emergency medicine, and the trauma that I suffered from, I see a sick patient at the emergency room. Then they come to the clinic. And then, it's very hard because here you don't have too much time to spend with them.
Right.
So that's why, my aim of this doing TV show Health Talk is mostly emphasized on the preventative aspects of medicine. Mostly, how do you prevent it? Just like you were doing. So basically, we are on the same page.
Yeah, I mean, many of these things can be prevented by treating that stress.
Right.
That
And
is
that's the
right.
prevention. Right?
Absolutely.
Yeah. So you tell us, Jacqueline, you tell us about your role, and
Yeah. My role has been
because your role is very important, significant.
I have a background in the medical field, and I also have a background as a real artist. So there's a
Okay,
whole nother
artist.
in art therapy as well. So when I work with patients, I absolutely love it because I'm able to really help them with the therapies, but the medication itself is absolutely incredible. And we really focus on, all of it, but the mind and body and creative spirit.
Mind and body
Mind,
syndrome,
body,
right?
and then
Mind
I
and
always add in
body,
the creative spirit
So
as well.
such an important
Yeah.
title, mind and body syndrome.
Yeah, and so really we focus on balancing that, really getting people feeling better in their minds, feeling better in their bodies, and obviously in the creative spirit, because that's where my heart really lies, is in the creativity part as well.
Yeah, so both of you work together. He creates and you follow, right?
Yeah,
He's the creator.
it has been really amazing. We've created a life together and,
You
and
created
a medical practice as well.
So where is your center located for the sake of our viewers who are watching me?
Actually,
Where are you located?
it's in Franklin, Michigan.
Okay.
We're in downtown Franklin.
Okay.
And it's a small medical little building.
Okay, and then they can reach you from this number.
Yes.
Yeah, yeah. And the website is Drake Center.
Yep.
It's
The DrakeCenter.net.
DrakeCenter.net.
Okay, that's good.
Yeah.
Now, so let us start with some of the common issues, that we, like post-traumatic syndrome, veterans coming back from the war. Now, children who got involved with a football injury, concussion, and they have this post-traumatic syndrome, PTS. So, now me as a clinician, we will do all the workup on them. Just I want to make sure they don't have any underlying pathology, like no history of thyroid or kidney or diabetes, blood sugar, and then we send it to you.
Yes.
So once they go to you, what do they expect at your center?
Yeah. So a patient who's coming to us for post-traumatic stress disorder,
Right,
for
yeah.
example, who's been appropriately screened, and there's no medical issue that needs to be treated, and that's all been taken care of. So when they typically come to us, most of our patients come to us after trying a lot of things that didn't work, and they're still being impacted by their PTSD. They can't sleep, or they're having flashbacks, or things like that. And they've tried medication, they've tried yoga and meditation and everything, and nothing's quite working. So when they come to us, we start with an assessment and an intake, and we get their story.
You do another history.
And we do a thorough history and a background and what happened to them and how that's been impacting their life. We follow that up with a preparation where we talk about this is what you can expect in the psychedelic experience. And this is how it can help you to transcend this trauma. And in that process, we sort of get the door open for them to have the experience. Then they'll come and see us at the Drake Center, and they'll have an injection of ketamine at our center. And as part of that process, we'll do a centering exercise. Jacqueline will usually lead them in a mindfulness exercise to get them comfortable and relaxed. Our center is very peaceful, and it's a really good environment to have the experience, because the mindset that you bring and the setting in which you have the experience have a huge impact on its overall impact. And then the patient will have that injection of ketamine. We give a shot in the arm in the office. They'll have a comfortable chair We give them an eye mask and a curated playlist of music. We sit with them during their experience.
The whole time.
And support them doing it, and then we discuss it afterwards.
So you listen to them.
yeah, so-
After you
and
have
after-
injection, eyes are closed, then
Yeah.
you listen to what they are saying,
Yes.
right?
And
then
I'm
we'll-
monitoring vitals as well.
Yeah,
during
right,
this.
of course.
And so then we have a short discussion about what was that like, what happened
Yeah.
for you, and many people will come out of it saying, you know, that was a really powerful experience. I felt like I felt peace for the first time, or
Relax.
I feel relaxed, or you know, I'm able to forgive this now, or I realize this thing I was really concerned about
There's
just
nothing.
doesn't really matter in the big scheme of things. And these can be really powerful realizations. And then following that treatment, we do what's called integration. And in integration, we actually talk about, now that you've had this insight, how do you make that a part of your life?
Right.
How does this has become something that stays with you as you go in your life, and be something that you can come back to as a source of wisdom and comfort, even in the future? So this treatment becomes something that doesn't just make people feel better in the short term, but cause long-lasting, transformative change.
Right. So you know, they once they get it out of their mind, you know, their mind is cluster free, right?
Yes.
Yeah. Don't
Right.
keep it in your mind. Open it up.
It opens their mind, frees up
Absolutely.
space. You know, they
Right,
actually
yeah.
release that emotion, and it frees up space for new emotion to feel
Right,
that
yeah.
area.
Get rid of the old.
Yeah.
Yes.
Yeah.
And it literally makes more space
Right,
as well
right.
in the brain.
So
And
there's
now,
that part.
Jacqueline, you tell your part.
Ah.
You are sitting with them
Yeah.
for
I sit
all
with the
this
patient.
time, and you note down whatever they are talking.
Yes.
Are you taping it, or you just?
We don't
write?
tape. I do take a lot of notes. During the actual experience, I mean, for us, it looks like the patient's actually sleeping.
Okay.
Majority of the time, patients really don't move very much. They don't really talk that much during it. It's really an inward journey.
Okay.
And by the time they actually get in the chair for the treatment, they've been prepped and they're ready for this.
Right.
They're ready to really experience something that will help them, that will really change and have profound effect on their life. And that's the part where the integration part, which we just absolutely love, because when they take a psychedelic experience and they actually are guided and, you know, it's curated pretty much for them. They go
Right.
in, find the thing that's been driving their anxiety or their depression, and really we take whatever the insights are from that and implement those into other therapies and stuff so they have those for the rest of their life.
Right.
And that's kind of where I come in, and we do a whole
When
bunch
you
of things.
come in,
Yeah.
and you kind of soothe the whole
Absolutely.
situation.
Yeah, and I teach mindfulness and meditation as well. That's
Yeah,
part of my
okay.
background. And s-
Meditation
yes.
plays an important
Yes.
role, isn't it?
Absolutely,
Mind
absolutely.
and body. You
It's-
meditate. And
Yes, and so I meditate a lot, and there is a part of it where, you know, mindfulness alone it starts actually with our intake. Actually, we start teaching them because in a ketamine journey, you really have to be aware of your thoughts. You have to be aware of really what they are. So it's like mindfulness 101, really, in that aspect of really just watching what our thoughts are, and they're just
Yeah.
thoughts, right? So we start there, and then we build it up, and
so, how long one session lasts for our viewers to know once they
Yeah.
go that initial evaluation followed by your psychedelics? So, how long each session lasts for them?
each session, the patient's actually under about 90 minutes. No, I shouldn't say that. We used to use oral, and now we're using IM, and the patient's about an hour.
1
They're
hour.
actually under, but the appointment is about 2 hours before, you know, with them
Right.
waking up and stuff.
So 2 hours.
Yeah, a 2-hour appointment. And we usually do those once a week for about
Oh.
6 weeks.
Okay, I was
And
going
each,
to ask
each,
you.
yeah, and each
I was
ketamine
going
treatment.
to ask you once a week for 6 weeks. Okay.
And each ketamine treatment is followed up by an integration appointment. We try not to do the integration right after a patient wakes up. It's usually 24 to 48 hours after. When a patient first wakes up, they're a little groggy. And so we let them kind of, you know, sit with it, journal a little bit about what they've had, you know, what's happened, and really kind of sit with it, because it's usually pretty profound what they've seen and gone through. So it takes a little bit of processing, and that's kind of where he and I do the integration.
Yeah, both
and
of you work
yeah,
together. Yeah.
And the way we have it set up for integration is we kind of go back and forth with our patients, and it's really important at the intake is where we really develop a care plan individually and so unique for each one of these patients that come to us.
So now the next question comes up. What are the psychedelic issues that you are using? I know one of them is mushroom, which is very interesting
Yes.
coming
So-
up
right.
for
So-
the treatment of depression.
Yeah.
Yeah.
So in our practice, the psychedelic we use is ketamine.
Ketamine.
And the reason we're using ketamine in our practice is at this point in time, it's the only FDA-approved psychedelic,
Okay.
the only legal FDA-approved psychedelic.
Okay.
Mushrooms and MDMA sort of exist in a dubious gray zone where they're decriminalized but not necessarily
Right,
legal. So ketamine doesn't have those issues, and it's effective.
It has been
you
there
know,
for so long.
and
also.
you know, as we prefer ketamine over some of the other psychedelics just for the dosing is very easy to adjust. You know exactly what you're getting, and it's effective. And so other psychedelics work as well. And in the future, as they become FDA approved, we'll probably add that into our
Right,
practice. But that's the one we're using right now. And ketamine, or in psychedelics in general, we emphasize the integration as an essential part of psychedelic treatment. There are some paradigms where patients will receive ketamine without integration, and they may feel better in the short term, and then it wears off.
Okay.
So it does have an antidepressant effect, which can be useful, but it's temporary, and that wears off. Integration, the therapy following, which allows a deep dive into that, anchors those insights and really guides transformative change. Not everything happens.
Right. Yeah. Everybody cannot be cured 100%.
Not everything happens in the session.
Right.
You know,
Yeah.
sometimes an insight may not be realized for a few weeks or a few months or even years. So
Yeah, it's-
long-time support and figuring that out is critically important for transformative change.
So that's
Yeah.
very good to know. But ketamine has been there forever.
Yes.
Yeah.
Yeah, and it is FDA approved. Whatever it is, the other psychedelics like mushroom, they are still experimental right now, right?
Yes.
Right.
So, and they've been around for a long time, and they're
Yeah.
safe and effective also.
Right,
They're
yeah.
just in this sort of gray zone at the moment. So ketamine's the one we use in our practice.
Yeah, okay. So now, I know you are an artist also. Can you tell us something, our viewers, about what are the artistic things that you are doing?
Yeah, for sure. Yes, my own work kind of had its own world, but I'll be honest, I am so proud of our patients' work.
Okay.
It is incredible. My own work it's out there. There's plenty of it out there. Lots of hospitals where my my work used to be in, and it still is. But the patient work is really incredible to watch.
Okay.
For years, I had always taken people into a deep meditation and painted with them and did group workshops. In fact, I had my own healing arts gallery, which is now our center. When I closed that in 2020, we decided to build our practice.
Oh, okay.
And we moved about a year ago back into the building that I used as my gallery. So it is a really special place.
Do you encourage paintings?
Yes.
And then,
I'm still working on my own work, but I also have
yeah.
all the patients' paintings there as well.
Okay, so that's great.
And
yeah,
that's incredible, yeah.
I think painting is a good way to relax yourself, right?
Yeah,
You think in
absolutely.
the mind, you imagine, and then you start painting, right?
Yeah, and I love it. The patients really enjoy it. After they have had a few ketamine journeys, I take a lot of notes during their sessions.
Yeah,
so if they
yeah.
do talk, I mean, we've had patients, it's been incredible stories. I could give you 20 stories right off the bat, but whatever happens during the ketamine experience, I'll even take some of that parts of it. So usually people don't talk very much during the actual treatment, but if they do, I'm right there to write it down. And because I meet people where they are creatively, Doesn't matter if they're a writer or if they're a musician or if they're
Yeah,
a painter
right.
or they love
It
to
could
dance,
be.
wherever they are, whatever that expressiveness is. But the reality is, it's been absolutely incredible to be able to get them to create
Yeah.
from a deeper place, and ketamine really takes people to a deeper place.
Now, do you help play some music also? Or
We, when they're-
especially for the musicians who are in the band and they get stressed out.
Yeah.
How do you handle them?
Yeah, there's a lot of, there's music therapies, there's all sorts of stuff, and including now that I've used the immersives, adding the immersive therapies in, which is also very cutting
Yeah,
edge.
yeah.
And I'm so excited that it's starting to become a little more
Yeah.
awareness now. But there's a lot in there as well. So we do all sorts of creative and very immersive type experiences.
Yeah,
So,
very
yeah.
soon you guys will become so famous. We'll see you on CNN. How about that?
Oh, goodness.
CNN, husband and
Yeah.
wife team with
Well,
turn that
we
Yeah,
love the
yeah.
work that we're doing. We both were in a place in our
love this
life
work.
where we needed a little transformation ourselves.
Right,
And
yeah.
getting to this place, it does seem like all of the modalities kind of came to this.
Yeah,
Everything that I've
yeah.
done in my past with the healing and the art, and what he's done with his work. And believe it or not, we actually used to work together. So there's
Really?
that.
Oh.
We
That's
did.
always
I was working as a nurse, and he was a resident during the time.
Oh, really?
Yeah, and
So
we
you
dated
know
all
him
3
since he
areas
was
of
a
his
resident
Yeah,
and
we
you
used to
grabbed
do.
him,
Yeah,
It's an intern.
we were
Yep.
hanging out,
How-
just having a
how
good time, and we
nice,
both were
yeah.
at Beaumont Hospital for many
Oh,
years,
okay,
many
that's
years.
great. Yeah,
And then
yeah.
after that, I decided to go further with the art. And
Yeah, so much better,
Yeah, we're
You're
really
more relaxed, you have your own time, right? You don't have to rush to the hospital.
No, such a different life.
such a different life.
Yeah.
And also, be honest, we really created the space to be not a sterile situation. This kind of work that we're doing is one-on-one. And it's really, it's so unique, don't you believe? I mean, it's so unique in how we put the care plan together for each
Right,
patient.
yeah.
The setting really matters with a psychedelic experience. The setting matters, I would say, maybe 50% of it at least, maybe even more, yeah. And so having it now at my space that was a healing space to begin with has been really amazing. So when people walk in, they're like, oh my gosh, I just feel better in here. And it's because we put a lot of work and energy into healing, into the healing art. I worked
Right,
with
yeah.
many hospital designers over my years.
Yeah, because you are
yeah,
artist, so
yeah.
she
And my work
you
is
bring
in
and your
healthcare.
works are so great. Yeah, I'm
Yeah.
sure most of the hospital would love to have your artwork.
Yeah,
there.
a lot of my work's at St. Joe's, Henry Ford hospitals.
Oh, okay,
yeah.
that's
Oh,
great.
it's-
Yeah, yeah.
You name it. Henry
Yeah,
Ford,
I
West
just
Bloom.
went to St. Joe. They had a merger with the March Children's Hospital.
Yeah.
So all the pediatricians were invited. I met so much pediatrician.
Oh, nice.
There, the lobby was full. There must be at least 200-300 pediatricians in the
wow.
lobby with the
Wow.
merger. Of March Children's Hospital with
Right.
St. Joe.
Mm-hmm.
It's a good merging.
Yeah, yeah. That's
Yeah,
amazing.
yeah, yeah.
My work is there on the 7th floor.
Second floor. Yeah, I
Seventh
can
floor. It's on the
imagine.
orthopedic floor. Big,
Oh,
big
in
painting.
the
Yeah.
orthopedic.
Yeah.
That's good. Yeah, yeah. So you must be knowing ahead of time who is coming to your center when, right?
Oh yeah. Our
yeah.
se-
You
yeah.
have
We've
a
had.
schedule. How many do you see in a day?
Oh, we see 3 to 4 a day.
3 to 4.
And every patient is an individual experience. We see one at a time.
Right.
And
Yeah, very
they get our
personalized.
full individualized attention.
Do you see all age group? Like
We see about 16 and up.
16 and up.
We find that there,
16 and up.
yeah,
Okay.
we find that there needs to be some element of a bit of emotional maturity for psychedelics to work.
Of course.
It some the ability
Right.
to deal with emotions and talk about them in a way that you need to have had some life experience first to
Yes,
be able to do
of
that.
course,
So it's more effective on people who have had trauma in the past
Emotional.
and are coming to us from something in the past that they're trying to resolve from. I think
Now with the COVID pandemic, I'm sure you must have got more and more It must, you must be seeing, has it affected your practice?
You know, we see quite a few patients that have long
Depression.
COVID.
Long COVID,
yeah,
yeah.
Or depression, or they're still getting over the pandemic
the
and the
COVID
restrictions.
pandemic,
And
yeah.
we have quite a few patients who are still dealing with that brain fog or just that lingering
Yeah.
malaise.
Loss
Yeah.
of family members,
yeah,
loss of
so-
job,
Yeah,
and so
yeah,
more
we've
than
seen
So,
a
you know,
lot
this
of
is
that.
profoundly effective for grief.
Oh, yeah.
You know, and I think that's one of the reasons why we really love this work,
Yeah.
is because we feel like we're really
Really help.
healing.
Yeah.
You know, I
Right,
feel like I'm
healing.
really doing what I always wanted to do.
Yeah,
Yeah.
the
just to
power
be a
of
healer.
healing, very
Yeah.
important.
Yeah.
So then I like to thank both of you, Dr. Drake and Jacqueline, for coming to my show today, and Director of Creative and Immersive Therapy. And anybody can reach them by going to the website, and they will you will get them and do the therapy. And just for the viewers to know, at least for 6 to 8 months, no, 6 to 8 therapy.
Yeah.
Yes.
Treatments.
Yeah.
We're typically 1 a week for 6 weeks.
1 week for 6 weeks,
Yep,
and
and-
later on they can
and then
follow
later on
up.
they can come
Yeah,
back, and some
yeah.
people come back for boosters.
That's
Yeah.
good. I'm so happy to produce this tape. I'd like to thank our producer, our camera crew for helping me produce these wonderful tapes. And I'd like to thank our viewers, and I wish everybody a very happy vacations. Merry
Thank-
Christmas and Happy New Year.
Yeah,
Thank you
thank
for
you so much for having
Thank
us.
you for having us.